But again, first trimester, we do a normal GYN, then we go lower uterine segment of showing the cervical os coming up, mid, fundus, pregnant. We magnify the fundus now, depending on if she's early, like 5-6 weeks, measure the sac. If we see a crown rump, we measure the crown rump. If the crown rump is not real precise as far as where we see to measure it, because maybe the yolk sac is, and it depends where it implants itself, measure both the sac and the crown rump. But normally once we get a crown rump, we don't do the sac anymore. Then for the crown, then if they get a little bit bigger, again, the crown rump you measure from the buttocks to the top of the head, not the legs, okay? Normally take 3 pictures of crown rumps. And if they all are within the same measurement, keep them. If you get one that's way off, there's a way on your machine you can delete it so that it doesn't mess up your average. And again, you know, in your manuals at home, at Vacutroph office, it should show you how to delete it. If you don't know or can't tell, just call your sales rep and he should be able to tell you right over the phone. Then when you're done with that, play with the baby, play with the mom, do whatever you can. And again, if the baby's at 7 weeks and it just begins to move, conception, 9 weeks menstrual age, that's when you want to kind of stop. Remember, and I showed you, just show that baby's moving, because it may go back to sleep and not move again for 10 minutes, because that's when it just moves a few times here and there. At 9, 10, 11 weeks, they're always moving. But nope, you're going to do, I'd like you to practice that routine. Here's your bladder, Andrina, and this is your uterus. And here's the gestational sac. And what we're going to do is we want to see the baby, so we take this box and we make it bigger, and then we zoom up so we can see what's inside of that. And I'm going to even go a little bit more so I can see even more inside the uterus. Okay, and what I'm going to do is look inside the gestational sac. We're going to look for your baby's heartbeat. And if our cameramen weren't here with their lights on, we'd see real well, but it's right here. You see the heart beating? It's really hard to see, but it's right there. What we're going to do is measure the baby. Did we get a crown rump yet?
No, we didn't. We couldn't get zoomed in well to.
Okay, honey, in order to determine how far along you are, this is your baby right here, and we've already established that it's got a heartbeat. And so in order to determine how far along you are, we measure the baby, and we call it the crown rump measure, and actually what it is from the top of the head to the bottom of his little bump, which is the rump. Okay, so what we're going to do is just go ahead and measure this. There we go. And right here, the machine tells us that your baby is 10 millimeters, which is 1 centimeter, which is that big, and you are 6 weeks and 6 days. And you can, that's from your first day of your last menstrual period, but your actual date of conception was 4 weeks, 6 days ago approximately. And your due date isn't marked on this, but we'll go ahead and get the wheel and figure that out for you. You know what, hon? I'm going to tell you something, okay? And you, Peter. You see here, we've got 2 sacs. You got the heartbeat, the yolk sac. We saw the heartbeat. And then we got over here, and we're seeing some fluid over here. And this is something we see a lot, so don't be concerned. But we have a pregnancy that started as a twin. And normally what happens with twin pregnancy is one continues to go, and the other one becomes kind of irregular. And there's very suggestive right here. You've got an irregular sac. We don't see any heartbeat in there. And sometimes we normally don't even know that you would have conceived twins if we did you a week later, because this would be totally gone. There would be no sign. But I'm telling you this because you may have a little bit of spotting, but I don't want you to think that you're losing. Have you been? I didn't want you to think you're losing your your other baby, because this one looks real good so far, okay? But just don't be surprised that you probably will experience some spotting. And if you want to have another ultrasound, maybe in a week later, I can try to. Do you have a doctor yet? Or-
I go to Center for Women and Children.
Okay, you might want to call them and they can follow you up with an ultrasound. But yeah, I do. I see some irregularity here. That's very suggestive that this sac you're going to lose, okay? But this one so far looks good. Do you see what I'm looking at, girls? Did you see that? Okay, see how this is irregular? And right. And you see how we get all this debris in here? And yet we could define the embryonic pole in here. So that's, and reason I've told her is because I do suspect that she probably will have some spotting.
Can you see, can everybody see that corpus luteum cyst there? The whole, no, that's where the X marks are.
Right in here.
See the measurement marks are where the corpus luteum. The purpose of a corpus luteum cyst is it is telling the body, I am pregnant. It actually will sustain the pregnancy until the placenta comes and takes over. So it's supposed to be there.
You're learning too.
Yeah. It's supposed to be there. In the first 3 months of pregnancy, there's a cyst on your ovary that says, I'm pregnant, I'm supposed to be here, keep it there.
Guardian angel.
I didn't have a camera working yesterday. I got it for today.
Okay,
There it is.
there's the gestation. Oh, that's the
And you
baby.
can even, the heart, you can see.
Bum, 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 bum.
Yeah.
You can see it. Boom, 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 boom. Okay, now, bless your little heart. You feel like you're gonna let it go flying, don't you? You can loosen up your grip a little.
I'm sorry.
There you go. She's got the death grip. It won't go away. It won't go, yeah, absolutely, absolutely. Okay, this is transverse cut. We're low. We're looking at vaginal canal there. Bright white line is actual cavity. Okay, swinging up, cervix. Got it? Freeze it.